when it comes to budgeting, there are many, many different aspects. And at MHB, what we were able to do in the last couple of years is try to harmonize the way those components, various components that are part of the process are referred to across different providers. So this is a small worldwide market. There are not that many compared to any other, medical procedure, let alone other major undertakings. It sounds silly to talk about it as a purchase, but if you compare it to any other major financial undertaking you go through in life, this is one that is still limited to a very small number of people. And therefore, there is very little standardization, very little, common practices, etc. So when almost every agency and clinic, mostly agencies I should say, but also to some extent clinics, when they start off, they create the agency, they almost have to invent their own pricing structure and come up with ways to break it down and come up with terminology for it. I don't think there was a lot of information exchange among these providers when they created their cost sheets. I mean, correct me if I'm wrong. So until recently, at least, there was you would go to a consultation with one provider and you would see a cost sheet that would look a certain way. You went to the other one, and not only would the numbers be different, but they were arranged completely differently. So there would be different categories, even the categories that are same, the terminology would be different, etc. So that's the first challenge we have. The second challenge is that regardless of the level of service you're getting from an agency or a clinic, there isn't yet any entity, and I don't even think there should be one, that can do everything for you all under one roof. In fact, there are some legal reasons why you should have some providers that are different. For instance, especially the independent legal representation that the surrogate has, etc. So that means that no one entity can give you the entire cost. And there are a lot of unknowns. There are obviously, one of the major components is the surrogate and her compensation, and that is a third party. That is somebody else that's not in the room when you're having this consultation with your agency or the clinic. So this is the challenge in budgeting for surrogacy journeys. And that challenge still exists, but what we were trying to do with the document that we have in our hands is to look at a large number, as it turns out about 50 of these cost sheets from agencies and clinics, and try to get some sort of a pattern. And what we figured is the first thing we figured is that it might make more sense to have one sheet where we would outline the costs for the agency and the surrogate, and another one we would outline the costs for the egg donor and the IVF clinic. This doesn't mean that the egg donor always comes from the IVF clinic, but they seem related enough and kind of fit into different portrait letter-sized sheet anyhow. So that's how we broke that down, and then we were starting to group them in a way that made sense, and come up with category terminology that we thought made sense. But I think the agencies, if they look at this, and we've had experience at least with those agencies, all three of you are part of GPAP, so they've had the experience of working with us to decipher their own sheets in a way that works with ours. And so far it worked. I haven't found an item that was left out of these categories. Likewise, and then the other component, as I mentioned, the other challenge was to fill in where there were a lot of uncertainties, or whether there were items that were not included, items that the providers did not necessarily include in their own cost estimates. So, and an agency usually will give you a cost estimate that is more detailed for what they are in charge of, and they will tell you, well, the clinic, we don't know, you have to choose one, and then there will be a lot of items that would be dependent on the choice of the clinic. If the clinic also provides the egg donor, of course, there's one cost, a scenario if the egg donor comes to a third party from the agency, the surrogacy agency, it's different, but there also would be circumstances such as where she lives that would dictate travel, or whether there's monitoring, third-party monitoring involved, etc., etc. As I mentioned this morning, if the surrogate works, she has lost wages. If she has a small child, she would have other, the babysitting, we might get into that in a few minutes. So the issue, first and foremost, is to try to go through all those. And right now, the numbers here are just general likely minimum and maximum numbers that we've seen out there. And just so you understand, actually the document explains that the bottom line numbers are not the sum of the items that we have itemized here. The itemized, many of those items are part of a broader agency fee or something like that. But if they're itemized, we try to give you the numbers that would be typical if that particular line was itemized, but many times it's included. So we feel that this represents a good way for you to use as a checklist, but also a good way for you to try to compare what you're hearing from the agencies and clinics to what we see out there on average. What we would like to do today is to try to not go through the entire list, but rather we chose two aspects that are, because agency fees are very easy to understand. Clinic fees, are relatively easy to understand because the clinics don't vary as much as the agencies are as far as their categories. And you once again can talk to the clinics and ask them how their costs would line up with a sheet like that. But what we want to focus on are the surrogate compensation package. Because that we find is one thing that is very difficult to understand. It depends on the policies of the agency. So the agency fees is only one thing that varies. How much the agency likely pays, or suggests as a compensation for a surrogate is another component. But agencies have different components, different policies as how they, compensate the surrogates, and we want to look into that. And the other thing we want to look into are the implications of various insurance situations for the surrogates, maternity and delivery. Here we're not going to go into it, but in other of our conferences we also go into the issue of the newborn care. But in the United States, assuming at least all but one here, I think are American residents, that's not going to be an issue because the newborn child or children will be covered under your insurance. So we're not going to get into that aspect. So this is a long introduction, but I wanted to first get you oriented and understand how to read this document when you go back home, and how to use it if you have an opportunity to work to consult with an agency or a clinic. We think that's going to be a good checklist to suggest that they look into. And then if they're not mentioning an item, ask them. So what about this? What about that?
Okay, thank you, Ron. I'm not sure there are trends in agency policies, but there are certainly trends in compensation to surrogates. Some agencies or programs, we use that term interchangeably. Well, first of all, we're all recruiting surrogates, and I think the three of us here have similar types of agencies where we're recruiting surrogates, screening them, and presenting qualified surrogates to you. Now, some agencies will say to the surrogates, this is what we're going to pay you. So then they tell you, this is what we pay the surrogate. Some agencies will allow the surrogate to say to you, this is what I want to be compensated. It doesn't really matter because there are some standards in what surrogates are getting paid, and the reason for that is the internet, really. The surrogates go online and they get to know each other. There are forums where they chat and they have communities, and so it's easy for someone to go online and surrogate, what might I be able to ask? So whether we're telling the surrogate what she can be paid or whether she's asking what she can be paid, it's going to be within a range. And those ranges are lately, it used to be lower, but because of the advances in medical technology and the advances in the law, surrogacy is more and more popular here in the United States. There are many people coming from Europe, from Israel, from Asia to have surrogacy in the United States because we really do have best practices here. So basically, we know, the professionals in the surrogacy programs, we know what those standards are that is right for a surrogate to be compensated. And Basically now we're seeing for first-time surrogates base compensation of around, at least this is what I'm seeing, and you could correct me if you have seen things, around $25,000. Occasionally a first-time surrogate will ask for $30,000. A surrogate who's carried once or more will be asking for a higher compensation. She's experienced. She has a track record of knowing what to do, so she's going to ask for initial compensation of anywhere from $30,000 to $40,000. We've seen a little higher, but that's not usual, and usually we tell those surrogates that that's too high and we won't be able to match you. So, so the trend, $25,000 to $35,000 for base compensation. If they carry a multiple, they'll ask for an additional $5,000, sometimes $7,000, sometimes $3,000 or $4,000. It depends, but you're going to see an additional cost to carry a multiple. And then I just want to say, compliments to men having babies, because this list is really great. You can really look at this list and see what kinds of items you're going to see in a surrogacy contract. I'm just going to offer my 2 cents here in terms of these bottom lines. I think actually the average of $79,000 is probably realistic. You might be able to do it for a little less than that. You might end up doing it for a little more depending on cost of insurance and what the surrogate is charging.
The 79 is for agency plus surrogate.
Right, it's not the medical.
And,
right.
And exotic.
And that's clear on the sheets. The back is the medical. This sheet is just the program and the surrogate and the legal. So I think the $131,000 seems awfully high to me without medical, and the $52,000 seems a little on the low side. But so this is a really comprehensive list, and I think Ron, pointed out really well that you should just be asking questions. You should have Skype meetings with us or personal meetings with us, and let us explain to you what you're going to see in your surrogacy contract. At a certain point, because you have these ranges, at a certain point, you're going to have a black and white contract in front of you, so you're going to know what the exposure is financially. And we try very hard to build in caps into the contract. So, for example, if a carrier goes on bed rest, if she works, she'll ask for net lost wages. Is that going to be an open-ended component for you? Most likely not. I mean, once in a blue moon, I see a contract where the carrier really doesn't want a cap. But you can kind of estimate it because you know what she earns. But 99% of the time, there's a cap on lost wages. So by the time that contract is in front of you, you know what to expect in terms of what your financial exposure is throughout this journey. So that's kind of like a, just a nutshell answer to your question. I'll open it up to the panel.
And when you also refer to it, I want to also understand, or maybe you can comment about whether there are geographical patterns associated with these base compensation and other issues.
I mean, I'll let the two of you answer that too, but I don't really see too much changes in geographical areas. Again, it's a small world because of the internet and people knowing a lot. I mean, you might see more in terms of lost wages or child care costs or housekeeping, those types of things that might change from region to region. But in terms of carrier compensation or payments for invasive procedures, I don't see too much change in that from location to location.
I think she's right in that the base things that you see, the invasive procedure fee, the base surrogate compensation, they don't really change based on region. But where we do sometimes see changes is we've got surrogates in California now who are asking for an additional monthly expenses allowance because, for example, gas there just costs more money than it costs in other areas of the country. See, if you've got a surrogate in Kansas versus one in California, their cost of living is going to differ quite a amount. So we do sometimes see those regional differences, but in terms of compensation, she's right, the internet is a great equalizer. And I think all of our agencies are very similar in that we're trying to keep compensation reasonable. You do occasionally have a surrogate come to you and say, I'm looking for $50,000 in compensation, and we have to explain to them that that's not something that's reasonable or that we find to be a reasonable fee. Occasionally we also do have surrogates who say, can I lower my compensation? Is it okay if I ask for less? And of course we always say that that is a great idea. So that is of course a little more rare, but across regions it's pretty similar.
Well, I'll talk trends, and I do see some trends that could affect compensation. And I just have one of those Google alerts where you type in your keywords and it pops things up. And I get ads now from agencies in California because of the waiting period for surrogates at most agencies that are openly advertising for surrogates with compensation of $45,000 to start. Now, some of that is bait and switch because they're including a lot of things that may or may not be payable, but I believe that this agency, based on the ad that I saw, is offering a $45,000 base compensation. That hasn't trickled through the industry, but it will because they are on the internet and it is a great equalizer. And when you start making $45,000 in California, getting $25,000 in Connecticut doesn't seem like so much fun. It's a function also of how your agency educates their candidates about the balance between fee-for-service compensation and altruism. And some agencies are very good at educating women not to take less compensation, but to be more altruistic. And I think that is one of the parts that can suppress the increase of surrogate compensation. The other trend I see is that there's recently been the first published tax court case that has determined that a fee paid to an egg donor is not a fee for pain and suffering or other things that are non-taxable. It's actually a taxable fee for service. If they have made that a taxable fee for service for egg donors, and I've already had egg donors ask for higher compensation to offset the taxes, it's going to trickle into surrogacy, and when there is the case that says surrogate compensation is taxable, you will see a bump, I believe, to offset for taxes. And astute attorneys that are representing surrogates in contract negotiations, I think, are starting to see that possibility. So just be aware of those things. I think those things do exist. They make, so the faster you start, the better it'll be.
He's not wrong, that's true.
Yeah.
Okay. Do you want to, just before we move forward with that, is there also maybe any reference to some of the extras you see? Because I know the base compensation tends to be more equal, and as you alluded to it, maybe Steve, sometimes there's a bait and switch type of situation, but I know there are agencies that do all kind of spa treatments and outings and other things. So it's not always, not everything is always the same as far as the package components. And I think maybe that's one way of maybe some agencies to attract surrogates. So you could talk about alternative to base compensation that some agencies are using that does add to the bottom line. Have you seen or have you practiced this yourself?
Well, I haven't seen spa treatments, although I have had intended parents offer nice things like that to surrogates, and I think that's a wonderful touch, if you will. It doesn't have to be an expensive touch, but I think to show appreciation for someone carrying your baby is a really important thing. One thing I see happening is that monthly allowance is going up a little bit. I think you spoke a little bit about that, but there is something in the contract called the monthly allowance. It's a payment of somewhere between $150 and $300 roughly per month, non-accountable allowance, and it's supposed to cover babysitting for routine doctor's appointments, gas, mileage. We try to put in co-pays for medical appointments, vitamins, any over-the-counter type medication, but it's really a non-accountable allowance, and for the most part, I would think it's probably not all being used, so it's kind of an extra payment to the surrogate. I'm seeing the surrogates ask for a little bit higher now, so $300 I'm seeing more often, as opposed to we used to see $150 or $200. You can probably negotiate that a little bit when someone says $300, but the question is how far do you want to go with negotiating, over $50 or $25 a month. I mean, it does all add up, but on the other hand, we don't want either she or you to get into a nickel and diming type situation. I mean, the negotiation should be really soft so that the relationship stays really good. So try to, when you're working with your lawyer or agency, to get up front before you get to the contract phase. Get up front what the compensation package is requested, so that you can then say to the agency, well, you know, what about this or what about that, as opposed to when you get to the contract phase and then you're actually negotiating. So it's just something to think about, to try to know as much ahead of time before you confirm the match.
We're seeing trends in things that provide little comforts, is how we like to classify them. I'm seeing more surrogates request things like housekeeping if they're carrying twins in the 3rd trimester. It's very hard to clean your house if you have a giant belly with 2 twins in it. So we're seeing that kind of comfort item be requested. I'm also seeing a lot of requests for doula fees or chiropractic fees to be covered. And these are little minor things. Maybe she's only going to go to the chiropractor once a month, but you should know that that's not something that's generally covered by most insurances, and factor in that she may request visits to a chiropractor to alleviate an aching back. We're seeing things like that tick up in comfort. I haven't seen spa treatments yet. Hopefully we're not going to quite get there, but I have seen the doula and the chiropractor and the housekeeping and, you know, as she said, child care, things of that nature.
So my only comment about the monthly allowance is that the purpose of the monthly allowance is based upon the fact that one of 2 things is true. Either the surrogate doesn't want to submit receipts for minor expenses because it's too much detail work. So she pays $7.80 for some vitamins, sending that in for reimbursement through the agency seems piddly. The other possibility is the agency doesn't like handling small receipts every month for reimbursement, because clearly the correct process is you pay the surrogate exactly what expenses she incurs and not a penny more, and she gets every penny she's entitled to and not a penny less. And the system to make that happen is that the surrogate submits receipts for everything she spends, and she only gets paid for her receipts. The monthly allowance removes the burden of receipts from someone that doesn't want to do it, and that's the reason it exists. And I think it is getting to be much more enhanced monthly compensation, because I resisted that for a very long time, because I thought, well, we're going to do our job, we'll handle the receipts, surrogate, you do your job. But when you're recruiting surrogates against other people that make their job easier, well, you have to make their job easier too. So we've done that. But what I did is I went over 50 to 75 surrogacy programs. I broke down the expenses that we were actually reimbursing for without receipts, and I averaged it out over the average program. And the number that I came out with over a whole bunch of programs is about $150. And I don't think that's unreasonable, and I think anybody that gets more than that, like Victoria said, is probably just getting extra compensation.
Terrific. And we didn't mention that, maybe we'll mention it later, but the issue of extra compensation for good insurance. Do you want to just maybe refer to that quickly now, and then later we'll explain what good insurance is, but does it still happen a lot, and if so, how much do surrogates get for insurance without exclusions?
I don't think that there is a clear system or impact of good insurance on the amount of the fee a surrogate charges, but in some cases there can be, and some agencies do use that. And what I'm talking about is